We are going to go over cardiovascular training methods today, which is chapter 14. This PowerPoint is a highlight of the most important content. So we definitely recommend reading the chapter when you have a chance. Probably will take about an hour or two because it is a shorter chapter. So plan some time to do that when you can. And let's get into it. If you have any questions, let us know. And let's go. An overview of what we'll be able to understand a little better after this lecture is some recommendations we can make to our clients in terms of cardiovascular activities, be able to give advice regarding which equipment to go on for cardio. Is it a stair climber that's good for our client? Is it a treadmill, rowing machine, elliptical, upper body ergometer, or stationary bike? We will also be able to discuss how to teach clients safe participation in group exercise classes and be able to match clients with the right cardiovascular activities that are compatible with their preferences and their capabilities. An overview of cardiovascular activities is that there's two main kinds, machine-based and non-machine-based. General guidelines for frequency, intensity, duration should be followed for cardiovascular exercise programs. Just like when we're programming for resistance training, we want to have general, healthy, smart guidelines. And then lastly here, general adaptations to the cardiovascular and pulmonary systems carry over well from one exercise modality to the next, but the stress placed on our musculoskeletal system can vary based off the mode that we're doing. And then a quick reminder, pulmonary system is our lungs. Let's keep moving on. Prehydration. The target is 5 to 7 milliliters of fluid per kilogram of body weight at least 4 hours before exercise. If you have a water bottle around you, look how many milliliters that is. In average, it's about like a water bottle per person 4 hours before exercise. And it might be a little more, a little less, depending on weight. But staying hydrated is really great advice for your client. Encourage them to drink throughout the day because of exactly this. Now, if they're not hydrated, their urine might be dark. So if you're in a situation where you're testing or they're letting you know this, if the urine is dark 2 hours before, they should drink an additional 3 to 5 milliliters per kilogram of body weight. Sodium. Let's talk a little bit about sodium. Including modest amounts of salt, aka sodium, in the pre-exercise meals or beverages can help retain fluid and stimulate thirst. Our biggest piece of advice is allow your client or encourage your client to carry a water bottle with them. If they're working over 90 minutes, then we would maybe want to encourage them to drink a sports drink. So the goal of hydration during exercise, the goal is prevent a body weight loss of over 2%. How would we know how much weight we're losing? One way is that you can, for yourself, just weigh yourself before you work out next time. This ideally would be weighing yourself with no extra clothing on, equipment, just weighing yourself. And then after your workout, weigh yourself again. How much sweat, how much water, how much of that did you lose in poundage? So our goal is not to lose less than 2%. That means that we're staying hydrated throughout our workout. We're able to replenish our body. And let's go on to the next one, fluid rate. However, we can't just keep chugging water. Since the body absorbs roughly 1 quart per hour, athletes can lose 2 to 4 quarts per hour in heat. We cannot necessarily catch up during the session, but we can keep drinking early and at regular intervals every 15 to 30 minutes to make sure that we're not losing that too much of that water, over 2%. Thirst. When we're drinking to thirst, we're drinking it. That's fine. For low intensity sessions, a drink will cool me down. But for high intensity or long duration exercise, it is really recommended to have a customized fluid plan because thirst is often a delayed signal. So you'd want to encourage your client or yourself to make sure you're taking those timed drinks and you're planning it out. There's an extra bullet point there just for fun. Water versus sports drinks. So if it's under 60 minutes, plain cool water is generally sufficient. If it's over 60 minutes or it's in high intensity and there's heat, we want to use a carbohydrate electrolyte solution or a sports drink. Something with a little bit of carbs. Composition, what's a good composition? Is Gatorade good? Is Prime good? Well, we want to aim for 6 to 8% carbohydrate concentration and 0.5 to 0.7 grams of sodium per liter. So make sure that you're checking that nutrition label and you're really getting that 6 to 8% carbohydrate concentration. Rehydration. So we're done working out. For every 1 pound lost during exercise, the client should consume 20 to 24 ounces, approximately 0.6 to 0.7 liters of fluid. So this is after we're done working out. We're encouraging our client or ourselves to, hey, get that water in. NSCA ACSM professional note, to fully restore fluid balance, you need to consume about 150% of the volume lost to account for the fluid lost through continued sweating and urine output during recovery. A little note about electrolytes. Post-exercise rehydration must include sodium through sports drinks or salty snacks to help the body hold on to water and restore plasma volume. All right, moving on. Clothing. Clothing for physical activity should be comfortable, light, loose fitting, or sometimes people also like especially mixed martial arts, clothing that is tighter fitting. So when you're grappling, it's easier. Just depends on the activity that you're doing, but you should always feel comfortable and always like your clothing is fitting. We don't want to take jeans or slacks or boots into a gym. And one of the biggest reasons why is jeans have buckles, boots carry lots of dirt sometimes, and buckles can rub against upholstery and wear and tear them over time. Their jeans are not flexible, can cause a really uncomfortable movement pattern. And boots, say that we're walking on a stair climber or anything, a treadmill. The fact that boots have big grips and they can track in rocks and dirt, those things can get stuck in the cardio equipment. So we just want appropriate clothing. And sometimes your client comes in and they're wearing a certain outfit. We might say, oh, maybe we don't train today until you get a change of clothes so that the session is easier and safer. If it's cold, we want to do layered clothing. And if it's hot and humid, clothing should be light and dry fit. Proper footwear that provides cushioning, stability, and or comfort should be selective and also relative to the activity in the individual. But how do we know which shoes to pick? We're going to get into that in the next couple slides. Running shoes, if you're running frequently, they should be replaced after every 300 to 500 miles or after every 6 months. Cool, moving on. Footwear. I'm gonna play this video. This video is mainly to show you that a test you could do for your client is have them run or walk on a treadmill, and you can sit behind them with a video camera and record them to see any movement patterns that should be taken note of.
Pronation is the act of your arch lengthening, resulting in an inward roll of the foot during ground contact. When the foot rolls inward an excessive amount, this is called overpronation and may lead to overuse injuries. Neutral shoes are designed for runners with neutral pronation or supination, an outward roll. Support shoes are designed for moderate overpronation, and motion control shoes are best for severe overpronation. There are 3 different tests that you can do to help find your level of pronation. First is the wet foot test. Simply place your foot in a bucket of water and step onto a piece of cardboard. Step away and check the shape of your footprint. Match the shape of your foot to the most similar shape shown here to determine the type of shoe you need. The second test is the wear test. Look at the forefoot area of your current shoe's outsole. Wear that's primarily in the pinky toe area suggests that you may need a neutral shoe. And wear towards the ball of the foot or the big toe suggests that you may need a support shoe. The third test is the treadmill test. For this one, you will need to place a video camera focused on your legs and feet behind the treadmill. By looking at the video in slow motion, you can see how much your foot rolls inward during your running cycle. If your leg and foot remain in a straight line, you should not need additional support beyond what your current shoe is providing. If your leg and foot are at a different angle, you likely do need additional support. Remember, choose your pronation support level based on the foot that exhibits the greatest degree of pronation.
Hopefully that is helpful. With the wet foot test, you can tell for your own foot what kind of support you would need for running or walking shoe. And let's look a little bit deeper into this. Running shoes are made with 3 different forms in the shoe when shoemakers call the forms of a shoe last. So running shoes are made with 3 different forms or last: straight for overpronators, that's the very top; curved for underpronators; and semi-curved for neutral foot strikers. It's important that we know how to recommend shoes for our client, so take note of this. Moving on, same information, just repeated in a different way. For overpronators, we want a straight formed shoe. It's going to give you high motion control. For neutral feet, we want a semi-curved form or last. It's going to give us moderate motion control. And for underpronators or supinators, we want a curved last. Overpronation occurs when the foot collapses too far inward on the arch with each foot strike. Neutral foot strike has a healthy arch. Underpronation or supination occurs when the foot strikes are too much on the outside of the feet and have too little inward roll. So that it makes sense that the curve is going to help push that over foot strike back to neutral. Footwear, remember, proper footwear is essential. You can look at page 378. It's essentially this table right here. So based on activity, we want a certain cushion and a certain lateral, which is the outside of our foot, on the outside stability. For walking, moderate cushion, moderate stability. Running, high cushion, low lateral stability. Aerobics, moderate to high cushion, moderate to high lateral stability. Racket sports, moderate cushion, high lateral stability. There's a lot of cutting footwork. Cross training, moderate high cushion, moderate high lateral stability. Running shoes, so this is footwear continued. They will ask you a question or two on the NSCA exam about footwear. So we really try to emphasize that it's important to choose the right shoe. Running shoes are generally made with 3 different types. So this is a reminder of forms: straight, semi-curved, or curved. On the left, you could see a straight last, you could see a semi-curved, and you could see a curved. Remember, the curved helps those underpronators because their foot is really going out towards that lateral area. All right, warm up and cool down basics. So we will show you, I'll show you where this link clicks to. It clicks to a sheet of NSCA specific warm-ups. You see a couple cool ones here. Quadruped reaches, sometimes we call that bird dog. Quadruped thoracic rotations. As you may notice, these are very dynamic. So we are not doing any static stretching in, we're not doing any static stretching in our warm-up. Moving back on, warm-up should begin with low intensity activity, low to moderate, with a workload that increases incrementally for 5 to 15 minutes. We want to see a bead of sweat on the client. We want them to raise the core temperature. That's the goal. We also want to make sure that we are activating the right muscles. We're mobilizing and we're potentiating. Ideally, we aim to increase body temperature, get muscles ready for this load. The cool down is same time, 5 to 15 minutes. We want to let the heart rate and blood pressure recover towards resting levels, slowly stretching the major muscle groups that we use and using breathing techniques. Dynamic stretching may also be added at the beginning as a reminder, and static stretching at the end. If you static stretch too much before a lift, we can lose power. Breathing. When we're doing cardiovascular activity, we should somewhat be able to have a conversation. We should be breathing comfortably, and we shouldn't feel like we can't catch our breath sustained. Well-trained athletes are going to be an exception, and it is a good reminder for us and our clients, it is not necessary to train in a state of breathlessness to achieve cardiovascular benefit. We can train in a state just above our homeostasis, and we can get cardiovascular benefits from that. We can manipulate our heart rate ranges so that we're not completely out of breath when we're doing cardio. When you're taking a cycle class or when you're taking a Zumba class, the idea is that we should be able to have somewhat of a conversation. So maybe we're taking a couple deep breaths, like, but we should be able to talk through it and sorry about that. And let's move on. What's on the right is we're showing a diaphragmatic breath. When we breathe with our diaphragm, we are able to utilize more oxygen. So sometimes it allows us to slow our breath down or have more intentional breath, send more oxygen to our brain. It can also help us focus a little better. It can also help us push out the right amount of effort that we need. So with diaphragm breathing, one simple way to try diaphragm breathing is if you are on a chair, not in a car, if you're on a chair that is in a room and you could put your feet flat on the ground and scoot to the edge of a chair and use both of your hands, you should be able to do this exercise. So if you're on a chair, scoot to the very, very end of your chair, plant both feet on the floor, not crossed, and put one hand on your belly and one hand on your chest. When you take an inhale and push your belly button into your hand and breathe into your belly. Or if that sounds kind of weird, just push your belly out while you breathe in. And then as you exhale, you're sucking your belly button into your spine. And your chest isn't moving too much. So let's practice a couple other breaths. A couple more. 2 more. Breathe in, belly expands, pushes against that hand. Exhale, belly comes in. Try one more on your own, and we'll move on. This is the ACSM 12th edition cardio guidelines. So a good framework on how to make recommendations for your client. We have the FIT VP framework. So FIT stands for frequency, intensity, time, and type. And then VP is volume and progression. Frequency, moderate intensity, at least 5 days a week. But if you're going harder or your client's going harder, 3 days a week is sufficient. A combination of both is also highly effective because variation. Intensity, 40 to 59% of heart rate reserve or VO2 reserve. When we just talked about frequency, how do I know what range is moderate and how do I know vigorous? Am I doing 5 or 3 days a week? Well, here are those percentages. Moderate is 40 to 59% of heart rate reserve or VO2 reserve, and vigorous is 60 to 89% of heart rate reserve or VO2 reserve. Now, how long should I be doing this intensity and frequency? Well, the time or duration for moderate is 30 to 60 minutes, totaling 150 to 300 per week. And then if we're doing more intense cardiovascular activity, 20 to 60 minutes per day, totaling 75 to 100 minutes per week. And what type should we be doing? Continuous or rhythmic exercises using large muscle groups. So this could be walking. Walking is severely underrated. Running, cycling, swimming, rowing, dancing. And then volume. A good volume is approximately 7,000 to 8,000 steps per day. For most adults who see significant health benefits, We know the common 10,000 steps. And then a target of 500 to 1,000 minutes per week. We want our individuals, our clients to be challenged cardiovascularly. So we want the effort of what they're doing to be a little more intense. Their target to be a little higher. Progression. So we want to increase duration slowly but surely. Maybe 5 to 10 minutes every 1 to 2 weeks before increasing intensity. So the first week I'm doing my cardio, maybe I'm doing 2 20-minute walks, and then maybe I'm doing the week after, maybe I'm doing 2 30-minute walks or 2 25-minute walks, and then I can start walking that 30-minute walk uphill. So we want to increase the time before the intensity. There is a variety of cardiovascular machines to get these cardiovascular recommendations done on. We could do treadmill, stair climber, step mill, elliptical, rowing machines, ski erg, stationary indoor bikes, and upper body ergometers. So on the right, on the bottom right, there's no seat for this one, so this one's a standing arm ergometer. Arm ergometer is like a cycle for the hands. So it's a great upper body movement. It's also pretty accessible for people in wheelchairs, which is pretty nice. The machine you see on the left, well, I've seen this at an expo for, I think the Navy booth had it. And it was a machine where you hold onto the rope. The rope does not move from what I remember. And then the legs have to be working to keep you upright. And I'm sure that the rope could also move. So what I recommend is whatever gym that you're working in as a trainer, get on every single cardio machine, even if you don't necessarily like it, just so that you can teach it one day if you have to, or show your client there's a variety of things that they could do. In addition, sometimes you want to give them cardio homework. Give them a variety of options. Maybe get in the pool with them one day. Make it super friendly to explore different cardio options. And remember, just because we don't like something doesn't mean it won't be amazing for someone else. So it would be totally worth it to try that cycle class, try that Zumba class, try that Les Mills class, whatever it is, just so you have more to give to your client. The treadmill, this is super important, NSCA specific. Before starting the machine, instruct the client to hold the handrails while straddling the belt. Have the client step onto the belt with one foot first. This is called pawing. So the belt is going to start running. Their hands are on the handrails. Their feet are on either side of the treadmill, not on the tread yet. And they're going to start using one foot to gently paw at the treadmill. That means they're going to put their foot down, let it ride the belt down, and lift it up. So they're going to paw. When they feel comfortable, they're going to start walking, but not lifting their hands yet. We want our clients to avoid drifting. That means we want them to stay center on the treadmill and not slowly float towards the back of the treadmill. They're going to fall off. Now, back to when they're first starting on the treadmill, they're pawing, they're walking, their hands are both on the handrails. Then they can release the hands slowly. All right, moving on. Running on a treadmill is easier than outdoors. It's just the lack of air resistance, decreases the energy cost, and can be offset by setting a gradient at -1%. Primary muscles used for the treadmill: quadriceps, hamstrings, gluteals, iliopsoas, tibialis anterior, gastrocnemius, soleus, and that brain. These are some other treadmills. If you have a chance to check out another gym or get on one of these treadmills. Some of these treadmills can reinforce sprinting, can enforce regular body mechanics, as you see the curved treadmill. Sometimes the first time on that treadmill, the calves are burning. So please check out other treadmills. We do have one in the rec, the bottom left. That is a self-propelled treadmill. There's no power. The more you walk towards the top, the faster it's going to go. The more you walk towards the back, even though we don't want to waver towards the back, it's going to slow down. Similar setup with all of these, have your client paw the treadmill, slowly walk, and maybe we don't release the handles ever until we feel super comfortable. The Woodway, the bottom left, often called a Woodway treadmill, those take a while to take. It might take a session or two or even a month to get the hands off the handrails. Those could feel a little funky. Moving on to the stair climber. So step climber, stair climber is actually the right way to say it because it's a bunch of stairs coming at you. Primary muscle use, quadriceps, hamstrings, gluteals, iliopsoas, tibialis anterior, gastrocnemius. Escalator type stair climbers reduce knee stress. Pedal-based stair climbers allow for those also used to be called step mills, pedal-based, allow for adjustment of stepping depth. Step depth and speed should promote proper posture. So if your client says, should I skip steps? Should I go backwards? Well, this is our scope of practice. Step depth and step speed should promote proper posture and work muscles appropriately. They should be 4 to 8 inches high and avoid excessive side-to-side hip motion. So for yourself, feel free to do things that you feel comfortable on the machine. But remember, we want to use machines as they're intended for so that we're keeping our clients safe as possible. We want to reduce handrail usage. So this is how we instruct our clients to eventually let go of that handrail. First, 2 hands lightly. So we're getting ready to let go of our hands. First, let's just gently grip the handlebars like they're made of marshmallows, so super light. Then the fingers of 2 hands. Then we're gonna move to 1 hand while swinging the other arm naturally. Then the fingers of 1 hand, then only the finger of 1 hand. And then we're eventually gonna release both handrails and swing arms naturally at the sides. So this is how we have to instruct our clients to slowly let go of the handrail. And although it might seem like common sense, remember the first time you got on a treadmill? Do you remember that feeling? All right, moving on. Body position for treadmill, step mill, and elliptical. Step mill is those little foot pedals that go up and down, up and down, up and down, and they never stop. It kind of looks like a piano foot pedal. They're called steppers sometimes. What this gentleman on to the left is an elliptical. So when we're on an elliptical, remember we should look balanced. Our center of mass, which is usually my torso, my center of gravity, my glutes, the biggest part of my body should be balanced. Head should be upright, looking straight ahead, shoulders squared and relaxed, torso positioned over hips, and knees should be aligned with toes and not move forward over toes excessively, but we know that a little knee over the toe can be okay, is okay. Stationary bikes. Sorry about that little missing picture right there. Indoor cycling bike uses gears, magnets for controlled, consistent resistance, making them ideal for traditional cycling practice. So we have some upstairs in room 203. You'll see in our room, it's a very small footprint. Continuing with stationary bikes, our handlebar position should allow, the one you see here is similar to what we were just talking about, which is indoor cycling bike. Handlebar position should allow the back to be tilted forward from the hips, not excessively though. We want a pronated grip, so we're not gripping underhand, and we're gonna avoid leaning on machines in general, but we're avoiding leaning on any handlebars. Remember, one of my favorite cues is just pretend like they're made of like paper mache. They're just there for that support. Primary muscles used is quadriceps, hamstrings, gluteals, iliopsoas, tibialis anterior, gastrocnemius, soleus. Next bullet point, stationary cycling is non-weight bearing and non-impact. So no weights should be on the bike because when we are mimicking a machine, we just want to mimic it as it would be used. And that's the safest way that we can explain that. So non-weight bearing, of course, we're bearing our body, but it's really light impact for our knees versus pounding like on the treadmill if we're running. The seat height, when we sit down, and we can extend one leg down, there should just be a slight bend in the knee. Shouldn't be super bent, and it shouldn't be locked out. The handlebars and body positioning, as long as the handlebars are higher than the seat, unless you're a professional cyclist, your back's gonna have a good time. The back could be tilted forward from your hips, but it should be rounded. And then back to the seat height, we want to make sure that if you're standing next to the bike, a good place to place the seat is like the widest part of your hips, or if you stand next to it and raise your leg to 90 degrees, the seat should hit you in the middle of that thigh. Awesome. Here's some pictures to show you. On the right, we have a couple different really good examples. All the way on the left with the knee fully extended, heel is on the pedal. B, with the knee flexed about 20 to 30 degrees, ball is on the foot of the pedal. Or C, with the pedal at 12 o'clock, knee is approximately even to the hips and thigh is approximately parallel with the floor. These are 3 things you can check to make sure that your seat is right. Those are additional things. I think the easiest thing to remember is once you're on the bike, extend one foot down, and you should just have a slight bend in your foot and you should be good. The most powerful pedaling force occurs during the downstroke, approximately 45 to 135 degrees, which is why it's super important for our bike to be set up right so that we can get the most out of it. To set the seat height, have clients sit with the heel on the downward pedal. 6 o'clock position, the legs should be straight. So as you can see, they are using the non-strap part of A. I would just go with what I said earlier, slight bend with one leg down all the way. Now there's a couple different type of bikes. There's a stationary bike, and there's also a recumbent bike. So it's semi-recumbent because we're not laying all the way down, but we do have more places for our arms to rest. So beneficial for overweight clients, individuals with low back pain, and pregnant women can really benefit from this bike. They have to balance their body less and keep their body less upright. See how his back is not forward of his hips on that left-hand picture? And if you're not looking at the slide, the recumbent bike is a seated bike. Your legs go out in front of you. Kind of looks like a banana bike almost. Also, it's just a bike where you don't have to climb too high to go on the seat. You're literally going to sit down in it. Heart rate, oxygen consumption rate, and rating of perceived exertion on a semi-recumbent bike are typically lower than an upright bike, but it's accessible and it's safe. An air bike, the air bike is also called a couple different bikes. You'll see one downstairs. There's resistance and it comes from the fan. So the harder you pedal, the more resistance is going to come, and it's going to be full body engagement. There's also group indoor cycling. Indoor cycling is often a higher intensity workout than individual cycling because the motivation, the energy, the vibes. Beginners should develop a good baseline level of conditioning before starting a cycling class, just because the cycling instructor, even though they should be able to teach to all levels, we want to make sure that everyone in the cycle class either knows to push to just their limits, even if the class is more advanced, or maybe they're doing a certain ride. As long as your client knows to modify, they should be okay. But it would be good to maybe hop on the bike for a week or two before just to get familiar. Proper fit based on the 6 points of contact, including handlebar adjustment, should always be coached to you during a group indoor cycling class, and I highly encourage you to take one if you can. The rowing machine, this is another NSCA specific question that will come up. They might say, what is the third part of the rowing machine? What is all 4 movements? But this is how it's going to look. So if you look at the top left, that's A, starting position, catch. We're going to end there too at the catch. Then we're going to push through our legs and drive. That's number 2, or the top right. The bottom left is going to be the finish, which the bar is at her lower chest. That's the finish. The recovery is on the way back, and the catch is back to the top left where she started. Primary muscles use the whole body. So it's a whole body machine. I think often people think it's an upper body machine while we use the legs a lot. Due to lack of familiarity with technique, however, beginners can use too much upper body movement, and intensity can be altered by stroke, pull, or air drag on the flywheel. There's even water rowers that use water as resistance. So important points is stair climbers do a better job at reducing impact and knee stress because the foot rarely leaves the pedal. Excessive, and even steppers would be even better because the foot never leaves the pedal. Cycling, same thing. Excessive leaning on handrails can reduce caloric burn by up to 20%. We ain't trying to do that. Clients should place the whole foot on each pedal. Knees should not come past toes excessively on equipment. We want to look like we're walking, we're balanced. Facing out is not recommended because we want to use machines as they're intended for and have good posture. We're not going to encourage our clients to take weights on the treadmill or cycle bikes because we want to keep them safe. Boots on the cardio equipment, as we discussed, we're going to get regular running shoes, just less wear and tear. Low impact cardiovascular training machines as well as swimming can be used for clients who have orthopedic problems like arthritis and low back pain too. This is good walking technique. We want a good postural alignment or walk tall. We like to say pretend that there's a string on top of your head and they're pulling it. Someone's pulling it really tall. Stride. Take long, relaxing strides. Lift knees, engage hips and glutes. Arm swing. Swing arms from relaxed shoulders. Pump arms with bent elbows, 90 degrees and higher speeds. So when you're going faster, bend those elbows at 90 degrees. Foot strike with walking is heel to ball of your foot. So please remember that. Walking, again, super important. Heel strike with a gentle roll of the foot. Hip action is going to affect stride length, and then arm and leg action should be coordinated with elbow at around 90 degrees. Race walking, performance improved by maximizing stride length. So if we focus on our stride length, we can walk a little faster. The leg is fully extended throughout ground contact and increased hip rotation when we're race walking. There's also some other non-machine cardio, running, swimming, group exercise. Running, for programming running, we can incorporate into a training program, maybe a client's walking 3 to 4 miles an hour without fatigue, then let's start programming running. So first we start with walking, and then we'll add the running. Then we'll start alternating between walking and running. We want to make sure that we have good form and technique because there's a higher energy cost and impact than walking. Avoid bouncing, seeking. We want to make sure that we're having the right footwear and seeking to correct foot strike abnormalities. Our stride length, the feet should land under the hips to avoid breaking. With swimming, we threw this in here so that you know the 4 competitive swimming strokes. Front crawl, also known as freestyle or front stroke, most popular and fastest stroke, breaststroke, butterfly, and backstroke. Adding and substituting new exercises, we just want to make sure that we are reminding ourselves of the principle of specificity. What is our client's goal? Why are we doing this? Are we keeping them safe? A client's ability to perform one exercise modality does not mean that they're going to be able to do the other. So just because they're really good on the elliptical doesn't mean they're going to be able to do the AMT, or the cycle bike. And then we want to make sure that we understand that every piece of equipment has a different level of difficulty, comfortability, and takes confidence and experience to feel comfortable on those pieces of equipment. So have patience. Group exercise, traditional aerobics, more known as group exercise now, is generally 45 to 75 minutes in length, includes some are 30 minutes. There's warm up. You don't even have to think about it. They'll take you through the whole class. Dynamic pre-workout stretching, aerobic activity, cool down, post-workout stretching. There's a combination of impact styles. So sometimes it's low impact. One foot remains in contact with the floor most time. Sometimes it's high impact. There's jumping. Both feet are leaving the floor. Step classes. So there's step classes. There's also step classes with music that are getting pretty popular. Step training, you typically use a small platform. It can go anywhere from 4 to 12 inches. 4 inches is just the step. And then 12 inches is about the step with 3 or 4 on each side of those risers. So if you look at the picture, on the bottom of the step, you see gray. That's going to be a riser. Participants step up and down to music, tempo, while performing various movements and sequences in step classes. There's higher impact sometimes, the higher the step goes, and intensity is altered by increasing speed, altering the step, and propulsive moves. There's also kickboxing, simulates martial arts training by using choreographed kicks and punches and punching moves. Kind of like turbo kick is a very popular class that will simulate martial arts. Typically, these involve shadow boxing, which is a great cardio session, rather than contact sparring against an opponent. It's important for clients to learn correct form for kickboxing moves to avoid risk of injury. Again, usually 45 to 90 minutes in duration, requires adequate time to warm up and cool down and stretch. For aqua aerobics, safe training modality because of the buoyancy of water, reduces the impact of landing on joints, excellent for clients who are elderly, obese, deconditioned, or managing musculoskeletal conditions. It can be performed in shallow or deep water with upright body position, performing various movements and activities. If you're submerged to the waist, you're bearing 50% of your body weight. If you're submerged to your chest, you're bearing 25 to 35% of your body weight. If you're submerged to the neck, you're bearing only 10% of your body weight. So something good to know. Runners can use water aerobics or deep water running as a supplement to dry land training to decrease that impact. And that's going to be our slide for today. So if you have any questions, let us know. Hopefully you have an overview of some machine and non-machine cardiovascular activities. What is your favorite? Let us know. And we will see you in class. All right, bye.